Cap and Trade, I'm on Energy and Commerce Committee. So we had the primary jurisdiction, and about 90% of the bill came through our committee. So it came to our committee. Interesting political analysis here is the White House's priority was health care. The Senate's priority was health care. But Speaker Pelosi led with Cap and Trade. She comes from downtown San Francisco and is really strong in the environmental movement in California, so Cap and Trade was her priority and brought that forward. I bring that up just in the sense that I think it made it politically more difficult for the president to do health care. So I don't know whether some want to thank her or not for that, but I just think it's an interesting political observation because it impacts in a variety of ways. But then we started on Cap and Trade. That's another bill I didn't support. I didn't support that because my conclusions from it is that it was a job killer for the United States. We're supposed to be focusing on the economy, stabilizing the economy, maybe positioning the economy for the future, because I think we've got a lot of work so that we will be the dominant competitor in a global economy. And that type of long-term strategery is not being done then or now. But people are expecting us to do something to help the economy, and here we are dealing with a bill on Cap and Trade that caps CO2, which, okay, we can have a debate about global warming, but I think if you can, you should reduce your emissions, and we all want a cleaner environment. But you also have to have a net benefit from that. And so the cost side of Cap and Trade is that every industry, manufacturer, entity that emits a certain amount of CO2 a year had to buy allowances from the federal government. The budget assumed it would be about $600 billion that they would pay, they as being like OPPD, ConAgra, and any manufacturer would pay in total to the U.S. government just to continue to operate. So that's a tax. Then the trade part of it was that if you didn't meet the cap that was set after you bought the allowances allowing you to emit CO2 to that cap, and OPPD, many others couldn't meet that cap, so they would have to go onto a trading floor designed by Goldman Sachs in a commodity trading way and buy credits from those that receive credits because they emit less than the cap, and trading back and forth on that. So OPPD, for example, I'm going to use them because how many of you use electricity? Okay. Their study showed that under the House bill, that the first day Cap and Trade went into effect, it would raise your electric bill by 25%, and Cap and Trade, just from continuation of having to buy the credits, after buying the allowances, would in essence double your bill over about a 15-year period. That's just the Cap and Trade part, not inflation, not increased coal cost or labor costs or anything like that, okay? So what I was hearing from manufacturers is, let's see, you're gonna increase our overhead costs to make a widget or whatever by 25% overnight, and then that's just my electric bill. And by the way, manufacturers and the industry use a lot of electricity. They're big users. Even the data plant that only has a handful of employees, their major cost is electricity. The new Yahoo data facility opened up in La Vista the other day. Major electrical user. So the cost of just processing the data would go up 25%. Well, it came home to roost when a local manufacturer, local right outside of Omaha, said, look, we already have an operation in Mexico. This passes, we're not even looking. We'll shut down the 200 jobs. So on balance, tremendous cost. What's the credit? What's the positive side? Well, while we reduce our emissions in the United States, overall emissions are going to increase in globally, and it had zero effect. I think it was 1/10 of 1%, 1/10 of 1 degree impact on global warming is what their scientists said. So on balance, horrible impacts with very little, if any, benefits to the United States and its people. Then we went right in from cap and trade to health care. And once again, this is a $1.2 trillion House bill, just under $900 billion in the Senate, their version. There's a variety of other costs in there that are mandated for others to pay for. Now, how many, just let me ask you a fundamental poll question. It's getting hot. How many of you here think that something needs to be done with our healthcare system? I'm raising my hand too. I really do. I've met people in the metropolitan area, people that are unemployed, younger people with families that don't have access to insurance. High costs are driving small businesses to dump health insurance. I've met with smaller employers that have had to make that tough decision, and they don't like it because many of them consider their employees family. And they don't like having to do it, but the higher cost of insurance is becoming a major problem. And that's all related to the high cost of medical care. It is a true fact that our medical care is the most expensive in the world. And we also have the highest standard of living, and there's some other things that come into that. And so I think you can't just do an apples to apples comparison here, but we are the most expensive, and people are getting left out. So facing that or defining that as a problem, that's Lisa. She's the communications director and thermostat control person. So make a long story short, if I'm looking at trying to solve that problem, what I want to do is look at our system and say, okay, where do we wring out high costs? What can we do to reduce costs overall to make it more affordable for others? We have Medicaid in place today that's for those at poverty or lower. So the lowest level, most in need in our community are already taken care of. What we're talking about here is kind of that lower middle class. I hate using that term. But those that are working, don't have access, they're either unemployed, and just the high cost of insurance makes it very tough for them. You reduce the cost of the medical care system, that brings down all of the costs, okay? So that's what we should focus on. And I've said many times that if our committee would just sit down, Republicans and Democrats, and write down the top 5 ways to reduce costs in the system, that not only would our list look pretty similar, transparency would be #1, I think, on most of our lists, for example, but we could come up with great ideas. Let's take the top 10 that we all agree on and make that a bill and reduce the costs. But in essence, the way I view the health care bill is what they've said is we in the government want to be in control of the dollars. And as a business person said to me, and I thought it rang true, and it's a great little quote, he said, all you guys are doing is rearranging the chairs on the Titanic, and you're not trying to plug the hole. And I thought, wow, one sentence, he wrapped it up.